Good morning. How are you? Yes. So the aim for first of all, let me give a disclaimer. I'm recording this video. Okay, I'm recording the conversation we are having. You will not come in the conversation. It's only me. Okay. I'm recording this for a teaching and an educational purpose, and the aim is to reach people who are diabetic, who are hypertensive, who are suffering from microvascular diseases with the correct informations. So you will not come in, I will not show no video of you, no picture of you. It's just maybe your voice that might be heard. Okay. So how long have you been diabetic for?
I have been diabetic for 2 to 3 years now.
And are you taking your medications seriously?
Yes, please.
Do you have some complications? How do you feel? Do you have some burning sensations? Your eye, do you see wall? Do you have any symptoms that you would want me to know about?
At the moment, since I started taking it, I've not been having
Yeah, no.
face I'm used to.
You used to. Okay, so that's good. So I'll be talking a little bit about microvascular disease. Okay, do you have an idea what they are?
No, please, no.
Okay, so microvascular disease is any disease that affects the small vessels in the blood, in the body. Okay, so it can be in the eyes, it can be in the kidneys, it can be in the nerves endings. Okay, like just those ones that are being affected. Okay, so that is microvascular. That is micro. It's very small. Micro, like little. Okay, and this tends to happen due to uncontrolled glycemia, as the sugar levels. It's due to that. It can be due to that. It can also be due to long-standing diabetic or other conditions like hypertension. Okay, a long-standing, because they are chronic conditions. If the patient stays, as you stay for a long time with the condition, then you tend to have that. Okay, yes. So these things, when they happen, can affect the eyes, the kidneys, and then the nerves. Okay, so when it affects, as I said, the common one. So when it affects the eye, we call it diabetic retinopathy. Okay, when it affects the kidney, we call it diabetic nephropathy, and then when it affects the nerves, we call it diabetic neuropathy. And that's why sometimes when you come and say you have some tingling sensations, we give you some drugs just to let that sensations go away. Okay, yes. So that is the basic concept, as in this burning sensation. And so you may ask, so why is it that when my sugar is not well controlled, I tend to get these symptoms? So it tends to occur as in the high sugars they damage the nerve endings, and then they cause inflammation. Okay, so this inflammation then leads to oxidative stress on the nerves. Okay, and then thickening of the capillary bases of the membranes, which impair the flow of blood. So when blood doesn't reach there, okay, the oxygenation, the amount of oxygen that gets to these tissues tend to reduce, and that leads to that pain that we tend to get. So as I already mentioned, some of the risk factors are poorly controlled sugars, that's glycemia, someone with a long-standing diabetes or hypertension, someone with high lipids, that is hyperlipidemia, your cholesterol is a bit high, someone who smokes, okay, someone who's obese or fat, okay, and lack of exercise. Okay, and so the aim of this is, how do then I prevent or help to prevent this? Okay, so you have to control your sugars. If you have diabetes, you have to take your medications for. If you have hypertension, if you have cholesterol, you have to exercise. Okay, and eat correctly, less fatty foods. Okay, if your sugars are high, you make sure it's well controlled. Okay, you also exercise, try and exercise, and then you screen for these conditions. Okay, how do you screen? You come to the hospital. Oh, I'm a diabetic, I'm a hypertensive, and then I want to be, what do I do to be able to get these things controlled? Okay, because the main problem is that these conditions in their early stages, as the retinopathy and all those, in their early stages, they can be prevented or can be regressed. Okay, as in you can go back to being normal. But once they reach advanced stage, there's no need of, you cannot go back. Okay, it then become complicated and chronic and okay. So how do you tend to know when you have this? Okay, so you can come with blurred visions, you don't see clearly. Okay, you sometimes feel numbness, like some burning sensation, some tingling. Okay, your feet can hurt, that's pain in the feet and that. Okay, you can have frothy urine, as in when you urinate you feel some foamy stuff. Do you see that sometimes?
Yes, sometimes I do.
Okay, that's maybe mostly when you don't take your medication, that's when you understand. And then sometimes you don't really feel your extremities, as in the way you are supposed to feel it, you don't feel it. Okay, so that is the main thing. So why are we doing this? The aim is that diabetes complications and all these microvascular complications, they are easily preventable. As I said, they can be prevented through education. So the aim is that we educate the public. They should be aware of what it is, what can be done about it, and how to prevent them, in order to prevent us from having long-standing complications that we cannot manage. Okay, yes. So my aim is to reach people who are suffering from diabetes, like yourself, your relatives who can be at risk, and anybody who is willing to learn. So I'll upload this video on YouTube. As I said earlier on, you will not come in, I'm the only person who will come in. Okay, yes, just that I need a patient to a interview or consult in order to get this information. So, okay, I'm very grateful for allowing me to use you for this practice, and continue to adhere to your drugs so that you don't get the complications as you already don't have. Okay, all right, thank you, have a very nice day.
Thank you.
Okay.